So today we will be discussing about the posterior superior alveolar nerve block. It is also called as a tuberosity block or as a zygomatic block. The nerves anesthetized are the posterior superior alveolar nerve and its branches, and the areas anesthetized are the pulp of maxillary's third, second and first molar, except the mesiobuccal root of the maxillary first molar. It also anesthetizes the buccal periodontium and bone overlying these teeth. What are the indications? When teeth involving 2 or more maxillary molars are there, and when supraperiosteal injection is contraindicated, like infection and acute inflammations. So the contraindication is when the risk of hemorrhage is too great, because this has a risk of hematoma. So now coming to the technique of PSA, we have to use a 25 gauge short needle, which is recommended. The insertion needle is at the height of the mucobuccal fold above the maxillary second molar. So here when you see the height of the maxillary, the second molar is here somewhere. And just distal to the second molar, you can find the mucobuccal fold. Okay, that is a soft tissue, a landmark, and along with that, you have the zygomatic process of the maxilla and the maxillary tuberosity as a landmark. So here the patient has to half open the mouth, halfway, makes better room or better visualization, and retract the patient's cheek with the mirror and pull the tissues taut. Now what you have to do is, you have to orient your bevel towards the bone and insert the needle at the height of the mucobuccal fold over the second molar. Advance the needle in the upward, inward and backward motion. Okay, advance the needle upward, inward and backward, and there should be no resistance felt once the insertion happens. The penetration depth should be, the average depth of the 16 mm is adequate, and usually for a 20 mm needle, it is 16 mm should go inside. That is 4 mm should be left behind. So after this insertion in the upward, inward and backward motion, you have to aspirate in 2 planes, followed by deposition of 0.9 to 1.8 of anesthetic solution. You have to wait at least 3 to 5 minutes to start the treatment.